Dr. Jitesh, welcome to Homeopathy.com. It's a pleasure to have you with us today. Uh, you have been a student here at the Other Song Academy since last 6 months. Please share your experience with us.
Here we learn what we see is what to treat. Be open-minded. They have various methods. Even though it's like other song entirely like people has impact that it's an entirely sensation thing we learn over here. It's very wrong. We are very open. What we see is to treat. As the patient describes, we treat. What the state comes here, we treat. It's not like that we directly imply a patient is going to sensation, so we give like plant, animal, mineral. So it varies, various approaches. We learn. I have improved myself. I have been to Greece. I learned with Holkers. Then I came down here. Then I saw how the sir takes up the case, their methods. It's entirely different. It's give whole new. It's like refining a homeopath. Going to the basics again, as we learn for 5.5 years. Then we go back again to look open Boger, open Fatak, and we learn whole different concepts that we missed out in all of the 5.5 years. So this opening to a new horizon, this has been very wonderful experience for me over here. Getting to the pathological, severe, destructive cases, how homeopathic takes up, and we promise not cure, but improvement, for sure.
What would be the difference between a cure and an improvement?
A cure, it totally depends upon the person and the case. Cancer in the last stage, we are not like how much sure. It's totally depend on the person's stage, how it goes on. We are not pretty much sure that we are confident that he will improve. How will improve is totally depend on the person's conscious.
You said that you have been to Greece and you have studied with Vithulkas also. What difference do you feel in their approaches and the approaches followed by Dr. Vithulkas at the IACH and here Dr. Sankran at the Other Song Academy? What difference do you feel is there in the approach?
Over there, it was entirely like on generalities. Sir has a different concept of layers. Vithulkas sir has different levels. Here are the different levels. Combining these all, it has a slight difference. Obviously, it's a different. But you have various things to come up. As the patients turn up with that particular symptom, just see what is to be healed and just prescribe on that. It's neither being fixed, it's asking a basis on generalities, on modalities, and just prescribing it. It's all about combining each and everything from top to bottom and then treat. It, as a Hahnemann says, it's that what we do on totality.
But as a student, how do you integrate your learning from two different school of thoughts?
Actually,
or you just dump one and follow other?
No, I'll be very open. Whenever I require, I'll be very open to these methods. It's like, whenever it's required, I feel that this thing to be asked and this thing to be as their way of their school of thoughts, I'll apply that. I'll be very open, and it's very good, it's like a new exposure to all the things. Like, it's like we should know all the approaches, because then only we can achieve to success. Only knowing one, being prejudiced, we will follow only this particular thing to get healed. It's not possible at all, at least for this generation. I believe it's not possible.
But was it difficult to make the switch?
Not at all. A bit, I can say, but not really, because I guess it helped me more get into depth.
Any reservations that you might have had before coming to the academy?
I was feeling that I'll get exposed to more new things. I had pretty much, because as I heard a lot about this sensation, how it works, and I had no clue at all. I was very much surprised, and the very first day I was like, everything is going off my head, because what I learned there in Greece, then I coming here, it was everything. But slowly when I came up, I was so astonished. I said, these things are entirely written what in books, entirely related. What we see, like in minerals, like right side, left side, losing atomic number, it was all matched, all linked up. It makes sense. Actually, it makes sense. Then it made me feel that, yes, I am in the right place. I have learned right thing.
And how is homeopathy taught here at the academy? What is it that you are taught?
To be very open to all the methods first, to to treat what is the patient's state is, and whenever you see the patient, observation and objective symptoms, although many of time it's very common, I guess you know very well, everybody says this thing only, that we have to observe, and we have to just note down how the patient walks, but we need to see how the patient is. We need to really make homeopathy is well known to treat the man in the disease, not the disease in the man. We have to do both. And modern medicine does just treat disease in the man, not the man in the disease. We do both. And we learn here. We have the different methods, like patient get into meditation. If the patient goes into meditation, it's good. If it doesn't go, just take at the factual level what he's saying and what he requires the help, what he really says, what his complaints are, just take that. But if patient's very much high on the spiritual level, he's just allowing us to make him go into that level and just see how it goes. And we make the patient speak what he really requires. So it all upon depends. And severe pathological cases coming up and have a different approach. So which medicine has that peculiar thing, how to take modalities, concomitants. So it has a different approaches to take. Sensation, animal, plant, mineral, they has a very sensitivity. The patient has a very strong sensitivity of fear, stramonium. It's like I'm giving just examples. So we need to see how the patient exactly present in our front of ourselves, and we need to cure that only.
So in general, you are happy and satisfied with your decision of following your education here at the academy?
Yeah, even I'm opening a center in my place. I'm from Odisha.
Okay.
So I'm taking up this center, satellite center over here at my place, and I'm really looking forward for people to join this and just get aware what real homeopathy is. It's not to be prejudiced in all the levels, either school of thoughts or it might be anything. Just to be open enough to judge, open enough to treat.
Thank you, Dr. Jitesh. It has been wonderful having you with us today, and I wish you all the luck for your future endeavors.
Thank you.
Thank you so
Thank you.
much.